We launched the Rebound Detroit to provide you with the resources and guidance you need to get you through these tough times. And right now, there's concern among COVID-19 patients and their families about affording treatment. And now, with one new drug showing promise, we examine what your insurance company may or may not pay for. As COVID-19 continues to paralyze our lives, in laboratories all across the country, the race to find a cure or, at the very least, a treatment is on. One promising solution is remdesivir. The National Institute of Allergy and Infectious Diseases recently published hospitalized patients with advanced COVID-19 and lung problems who received remdesivir recovered faster than similar patients who received a placebo. But how much will this cost?
But we looked at the fair pricing from two different perspectives.
Dr. Steve Pearson is director of the Institute for Clinical and Economic Review. He says $4,500 would be the fair price for the treatment based on his team's research. However, what the maker of the drug Gilead will charge is unclear. It could be more or less. But the Gilead company has a history of frustrating consumers. In 2015, it charged $84,000 for their drug Sovaldi to treat hepatitis C. That breaks down to around $1,000 per pill. So far, the company has donated its entire initial supply of the drug to the federal government, who will decide where it can be used. But eventually, that will change. Pearson says the country should watch more closely as to what happens next.
It may be that the traditional way of letting a drug company name its price and seeing what the market will bear is just not going to be the smart way for our country or for the world to approach this.
The National Institute of Health, headquartered in Maryland, has spent nearly $700 million over the years researching coronavirus treatment, and traditionally the government does not share in the profits or set the price. The last time the federal government made a major attempt to set the price of any drug was post 9/11 and the anthrax scare. While Congress is keeping an eye on this letter has been sent to the Health and Human Services Secretary asking for oversight. Taxpayers are often the angel investors in pharmaceutical research and development, yet this is not reflected in the prices they pay.
If cost becomes a barrier to people getting the treatment or getting vaccines or getting tests, then we're actually not going to solve this public health crisis.
What happens next with remdesivir is very much in the hands of Gilead, with the nation watching. So here's the Rebound rundown. One drug, remdesivir, has shown to be successful in treating COVID-19. The initial supply of the drug has been donated to the federal government. We will watch the price of remdesivir closely to see what COVID-19 patients will be paying in the near future. Now, if you are a COVID-19 patient, you should be asking for an itemized bill for any treatment. So if you have to question your insurance company about a payment, you want to know exactly what you've been charged for and how much. Now, if you need help bouncing back in the wake of this pandemic, if you have a question or just want to share your story of recovery, email us at rebounddetroit@WXYZ.com.